I'm Mary Krogan. I'm the Provost and Executive Vice Chancellor here at UC Davis. I only began as Provost in EVC last July, but in fact, my time with Davis goes back much further. I'm an Aggie myself. I graduated with my bachelor's here in 1982. I'm an Aggie parent times two and other family members. But most importantly for this talk today, I have been an epidemiologist for almost 40 years. So coming in last July in the middle of the pandemic and having an epidemiologic background was incredibly interesting and helpful to be able to determine what we needed to do to make sure that all of us on campus remained healthy. And in fact, we extended that out to the greater Davis community and now beyond to all of Yolo County. So our original commitment to the campus was to eventually be able to return to 100% in-person instruction. We wanted to make absolutely sure that we followed all public health guidelines, both for the county and for the state. That is an imperative. But last year at the same time when I was coming in as provost, it was also very clear at that time when there were no vaccines available, they were still in final development stages, that the virus could be far too easily transmitted. And bringing people back together in dense classrooms and other campus activities, even in our research laboratories, was going to be problematic and people were going to get sick. And at worst case, people were going to get very severe illness and possibly die from COVID. We did not want to have that happening as a function of activities on either our Davis or Sacramento campuses. So we'd already turned to remote instruction in March. When I came in July, we made the decision to continue remote instruction for this entire past academic year of 2020-21, and to be prepared to open fully in person this coming fall. Our decision with the development of vaccines, very important and central to this webinar today, our decision was based last December with actually a public announcement going out to the entire campus and beyond. And that announcement was made December 18th, 2020, that we would in fact return to full in-person instruction this fall. So it's announced quite a while ago now. Preparations have been made. Everything around the pandemic with vaccine development has made it possible for us to return to full in-person instruction this fall. The vaccine mandate by the University of California was the most significant and critical component in our decision-making to return to full in-person instruction and research and be able to take on our community service again. While last year, we went through a very rigorous process to determine which classes could be taught in person. And in contrast to this fall, where it will be virtually every class in person, last fall it was less than 1% of our undergraduate courses and a majority of our health-related courses in medical school, the nursing school, and the vet school were in fact taught in person because of pedagogical reasons and the need for critical workforce development. So this fall, we're in a very different place. Vaccines are the central part to that. The intent is to return to in-person instruction. People will be talking in later talks here during the webinar about other aspects of the vaccine mandate and so forth. But the most important aspect is that we are following all public health guidance from both the state and the county, whether it's Yolo County or Sacramento County. All of our students will be wearing face coverings in classrooms and laboratories. All the instructors will be wearing face coverings. And just to be clear, that's a little different from what we thought prior to the Delta variant being so present. We thought we could have instructors not wear face coverings, but we need to follow the public health mandate now that everyone wear face coverings, regardless of whether you're vaccinated or not vaccinated, to wear those face coverings indoor. We will continue our asymptomatic testing program, fantastic program that even made it to the front page of the New York Times. But with any updates about the frequency of that testing, please go to the Campus Ready website, and there will be other speakers in this webinar to speak to it as well. So as I've said at least 3 times now, central to this return to in-person instruction, research, service, all of our campus activities is really the vaccine mandate and that everyone be vaccinated. If you have not been vaccinated already, I sincerely hope you will do so. We have information that we'll be providing during this webinar that may help you get over any hesitancy you have around that, obviously answer any questions or concerns. Or I know for some people, they're also anxious about returning to work. I think the vast majority of us are very happy to be back. It may take some people a few days to adjust to being back in the office and so forth, but there is a reason we have a residential campus here at UC Davis, that hallway conversations, in-person meetings, in-person instruction, and certainly research in its variety of forms that are conducted in person, in fact, have been shown to be more beneficial, stronger retention of the material, and more enjoyable for people. So please get your vaccine, enter your vaccine information into the system. I thank you all for being here with us today as part of this very important webinar, and I wish you all the best and look forward to seeing you in September.
We're now moving along about the UC vaccine policy. Eric Cavigny is Associate Vice Chancellor with Safety Services. And Eric has done just about every Campus Ready webinar so far. Isn't that right, Eric?
Unless you didn't tell me about some of them. Thank you, Grant. Thanks, Mary. Appreciate everyone for making the time today. I'm going to start with a little overview of the policy itself. Next slide. So as Provost Krogan mentioned, our vaccine policy and ability to vaccinate our campus is central to our ability to get back to business and in person with all of the activities associated with institution of higher ed. So we thought it appropriate to start with about where we are at with our vaccination rates. The numbers that you see here, I am certain are low. And the reason why I say that is because we only report what we know. So there's a variety of ways to get vaccinated, and we are collecting that information from each of you, our affiliates, into our various systems. And so the numbers here reflect basically only what we know. I will say that since the policy was promulgated here July 15, I think, those numbers have been increasing. They continue to increase, and I'm confident we're going to be in a good place by our implementation date in fall. Next slide. So I want to reiterate that vaccination is indeed our most effective tool. I sincerely hope each and every one of you will get vaccinated. For policy specifically, just generally, the scope of the policy covers every student, every staff, and faculty member having any in-person responsibilities. I want to emphasize the word any. So the scope of the policy is not delimited, is not time delimited. In other words, I only have to have in-person responsibilities once a week, once a month, once a quarter, once a year. The once is the trigger for the policy. The implementation date, which is different from the policy effective date, which was July 15. The implementation date, we've published a variety of ways, but it's there on the screen in front of you, is September 8 for our Davis campus and September 1 for our Sacramento Health campus. And really what that boils down to is that there's two ways to comply with that implementation date. A, you get fully vaccinated. Later on, we'll make sure that everyone has a clear understanding of what that definition means. Or B, per policy, you obtain one of the exceptions. So on the right, Grant mentioned earlier, we're going to attempt to address most of the frequently asked questions we've already received. So we'll start here with this first one here. If I wear a face covering and test regularly, then why do I need to get vaccinated? So understand that face coverings and testing, I'll add that in, are effective mitigations, but they're just simply not as effective as getting vaccinated. So as I led with, vaccine remains our single most effective tool to reduce the virus, and frankly is central to our ability to return to, I'll say, normal in-person instruction in fall. And so the second FAQ there, what are the requirements for volunteers, trainees, and visitors? So we recognize that group as being within policy, but we do not yet have those expectations and process worked out. So as we get to being able to finalize those process for those groups, we will certainly communicate what those are. Grant, go next slide. Okay, so under policy, generally there's a few pathways for exception requests. We're going to spend some time on what those actually mean, but as an overview, I wanted to start with a separation of process with those exception requests. So employee requests we manage by Sedgwick, and Sedgwick might be a new name or entity for a variety of you here with us today. So let me just elaborate a little bit about Sedgwick. Sedgwick is our third-party claims administrator handling, I'll just say, run-of-the-mill claims made against the university on a variety of coverage lines, as well as through litigation and kind of some special business as well. They've been with the university. We've had them as a business partner with the university for decades. So we've been able to leverage their, I'll say, business acumen and process to specifically support this policy while applying the same criteria universally for those applications on exceptions across the system. So it's not just UC Davis, but in fact, there's several of our sister campuses that will be using Sedgwick for those employee requests as well, which is separate from the student requests. So none of the student requests will go through the Sedgwick process. And instead, exceptions for the student requests, the medical ones will go through our student health and counseling services team. The religious exceptions will go through a student affairs team. And again, using the same criterion as the rest of the UC, as well as what Sedgwick will be using. So requests that are unable to be approved will be escalated through the appropriate review channel. So to be clear, Sedgwick, for example, on the employee side, will never issue a denial on either the religious or medical side. And to the extent that we believe a denial is possible, the process includes secondary reviews under a UC Davis team on the religious side, as well as on the medical side through the appropriate campus medical director. I'm going to move to the FAQ there on the right. Can I appeal the process if my request is not approved? No, there is no appeal process. If a denial decision is reached, you will need to get vaccinated. the second question there, will the flu vaccine be required this year again? So yes, indeed it will. We don't have the details regarding implementation dates, but they'll be forthcoming as we get into the flu season. Grant, we go to the next one. Okay, so the do's and don'ts on compliance. So I'm just gonna I'm gonna read from the slide here because I think they're fairly straightforward, right? So please inform your staff that staff and students that compliance with policy is by September 8th, and the way to achieve compliance is by getting vaccinated or receiving an exception. And please ask now if your employee or staff anticipates any barriers preventing them from gaining compliance, because we want to be able to work on those situations ahead of September 8th so that we can avoid an escalation process. On the kind of the right side of that slide there, so please do not ask if an individual will be filing an exception request. As supervisors and managers of policy, we don't care. What we care about is compliance with policy, and there's a couple ways of doing that, right? Do not ask if they will be vaccinated. Again, same answer. We do not care with how someone is complying with policy. We're going to review how to do that. You don't need to know the method by which that happens. Do not ask about any medical condition, and do not engage in a discussion about the legitimacy or adoption of the policy itself. On the right side of that slide, the other FAQ there, can I ask my students or staff if they are vaccinated? So it's not a straightforward answer, but let me give a little bit of context. So if there is a business reason to do so, the answer is yes. If there's not an expectation of behavior change, so for example, a business reason to know, then the answer is no. So for example, a business reason might mean that masking policy at the time is different between a vaccinated or unvaccinated person. That'd be an example of a business need to know. I will also indicate that our systems of compliance are built around compliance with policy. And so right now, that's through our daily symptom survey, which clearly indicates which way an individual needs to go with respect to masking policy, when indeed it's different. And then I'll mention, just as a maybe planting the seed a little bit, in the fall, we will be modifying that compliance process, stepping away from the existing version of the daily symptom survey and moving to an application that resides on our EMR system. It's the badge system within Healthy Messaging. You don't need to worry about the detail now. We certainly will be communicating the specifics of that transition around the first week of September. Okay, next slide. So I'm going to talk briefly about the religious exception process, and then Dr. Shoresman, following me, will talk in detail about the medical exception process. So under the religious exception, so policy allows for an exception based on a sincerely held religious belief, practice, or observance that prevents you from being vaccinated. The review process that contemplates denial will include, it's both an internal review and then a UC Davis team review prior to contemplating any issuance of the denial. As I mentioned before, if we end up getting to a denial, you will need to get vaccinated. Approval under an exception process means that you're compliant with policy, but I need to highlight the fact it does include an agreement to comply with mitigations, otherwise known as non-pharmaceutical interventions. So for example, face coverings, and of course, our testing program requirements. On the right side of that slide there is the FAQ. right? What's the basis for receiving a religious exception? So as defined by policy, the basis for acceptance is grounded on a person's sincerely held religious belief, practice, or observance. And so I think we have next slide, some workflow graphics, which I don't think I'm going to go through in detail. Grant, do we have those graphics or no? Okay, kind of some small print here. The left side here is the intake, which is different depending upon campus and health. But once you get through the intake process, again, those are communicated separately. For the employee religious exception, again, Sedgwick is, I'm pointing with my pointer and I'm realizing that you all can't see that. Sedgwick is reviewing those applications, again, according to UC policy. If Sedgwick's able to approve, kind of on the top of that slide is the process by which the employee signs the agreement, agrees to the NPIs. Sedgwick will issue the formal adoption, the kind of approval of that exception. That gets returned to, the data is sent back to our UC, our programming team, and the file will be flagged that the employee is compliant with policy, but needs to maintain those testing and masking requirements. Kind of at the bottom of that slide, if for whatever reason Sedgwick reviews that exception, determines they are unable to approve it for whatever reason, it'll get returned to UC Davis. And again, the UC Davis team will review using the same criteria, make a final determination. And again, if the determination is an approval, the acceptance will indeed come back through Sedgwick to collect the agreement. If the final determination is a denial, then it will come from UC Davis. And then I think we have one more slide on the student workflow, which looks different, but the concept is the same. So simply remove Sedgwick from the equation, and instead, upon intake, the exception initial request is reviewed by a student affairs team, goes through the same criterion and analyses. If that student affairs team is able to accept, then the application will receive an immediate kind of confirmation along with the same kind of form to agree to the non-pharmaceutical interventions. The flag is filed as being compliant with policy, and we're on the way. If the student affairs team does not believe they can approve it, then it will get remanded to the UC Davis religious exception team, again, for the same review and final determination. Okay, I think then we're going to move to the details that Dr. Shorsman, our Director of Student Health and Counseling Services, will review on the medical exception and deferral side. Dr. Shorsman?
Thank you very much, Eric. Hi, my name is Cindy Shorsman. I'm the medical director here at Student Health and Counseling, and I'm campus lead for efforts such as testing in our campus vaccine clinic. Next slide, please. So I'm going to reiterate the main message of today's talk, which is please get your COVID-19 vaccine if you are at all able. It is strongly recommended, it is safe and effective, and we'd love to see you at the COVID-19 UC Davis ARC Ballroom Vaccine Clinic here on campus. So far to date, we've administered more than 20,000 doses of vaccine. So, and we have good availability. We are doing Pfizer only at this point, so please come see us at our campus clinic. Please remember that once you get your vaccine, it is a 2-dose series. So you'll get your first one today, you'll get your second one in 3 weeks, and then you will be considered fully vaccinated in 5 weeks from today. And we'll go over that timeline. while you're going through that process of becoming fully vaccinated, you'll be considered conditionally compliant, but you do need to finish your series. One of the FAQs that we commonly get is, who has access to my medical records? Please remember that this is regulated by law, and anybody who tries to get into a medical record has to understand those rules and has been formally educated on those laws. They have to have a business need to do so. So these will include your medical providers who are trying to coordinate and perform your medical care. And these may also include those acting in a public health capacity, such as those case investigators and contact tracers. Another question we commonly get, so I started a vaccine series in a different country. Now I'm in the United States. Can I finish my vaccine series by getting Pfizer or Moderna here? Unfortunately, the answer is no. We don't have the ability to mix and match our vaccines in the US with those available in other countries. So if you did start a series in another country, but were unable to finish it for any reason, we would recommend revaccination with a complete series once you come to the United States, and we'd be happy to see you in our vaccine clinic. Next slide, please. So just so we're all on the same page with definitions, what is fully vaccinated? So fully vaccinated means that you have completed a COVID-19 vaccine series at 2 or more weeks ago. So anything else, you are not considered fully vaccinated. So unvaccinated means, for the purposes of the mandate, you haven't received any vaccines against COVID-19, you received some, but you haven't completed your series, or you've completed your series, but you're still within that 2-week window after vaccination. Another question we commonly get is, why did the UC choose to implement the vaccine policy without final FDA approval? The basic answer is science. We really looked carefully as a UC system at the available studies and the efficacy of the EUA approved vaccines here in the United States, and of the efficacy of the WHO EUL vaccines available worldwide. And then there were many conversations with chancellors, academic senate representatives, UC health leaders, and other university stakeholders. And the decision was made to go forward with that policy in our very best efforts to help protect the health of our campus community. Next slide, please. So this is an overview. You've heard the definition of fully vaccinated, so you can probably kind of walk it back yourselves with regards to the vaccine mandate compliance deadline. But just so you've seen it, if you were going to become compliant by the mandate compliance deadline, with Moderna, you would have received your first dose on or before July 28th. That's because there's 4 weeks in between Moderna doses, and then remember that 2 weeks after in which you're not still considered fully vaccinated. So you would count 6 weeks back from the vaccine mandate compliance deadline. Today is August 4th, so if you're planning on becoming compliant with Pfizer, please get your vaccine today. And you can come to our vaccine clinic on campus, and we would love to see you so you can become compliant with your first dose today, your second dose in 3 weeks, and then 2 weeks later, you would be fully compliant. There also still exists the J&J vaccine, Johnson & Johnson vaccine in the community available through my turn. Remember, that's a one-shot series. So if you choose to get that, then 2 weeks after that shot, you will be considered compliant. Next slide, please. Remember that we have those 3 vaccines EUA approved and hopefully soon to be FDA approved in our country, but there are other really good vaccines out there worldwide, and we are accepting all of those that are WHO EUL approved. That list is constantly changing because the WHO, World Health Organization, is constantly reviewing studies and making sure that they're up to date. So there may be additional ones added to this list. But at the time of this presentation, you can see the WHO authorized vaccines listed. Those include the 3 available here in the United States under EUA, Pfizer, Moderna, and Johnson & Johnson, as well as AstraZeneca, Covishield, Sinopharm, and Sinovac. So the question comes up a lot. What do I do? I'm living in another country. So if you're able to finish one of these vaccine series that is WHO authorized under EUL in that other country, 2 weeks after you complete that series, you will be considered fully vaccinated and you won't need to do anything else at this time. You just get that uploaded and you'll be approved. If you either were unable to complete a full series or you got one that is not WHO approved, then we're going to want to see you, and you'll have to start a series here to meet the vaccine mandate. And we do know that there are people who cannot get vaccinated where they are. So as soon as you get here, engage in the vaccine process, get your first shot, and you won't be penalized as long as you're actively working towards the getting fully vaccinated and are in that window where you're getting vaccinated right when you can. So we'd love to see you as soon as you come. Next slide, please. So let's say you can't get vaccinated because you have a medical condition that prohibits it, or you're looking for a pregnancy-related deferral. So let's talk about that process. You are allowed to request a medical exception or pregnancy deferral as a way to comply with this policy. So those differ a little bit depending on which one you're talking about. For the medical exception form, you have to get that completed by a medical provider, that is a physician, so MD or DO, or by an NP or a physician's assistant. And then you'll need to submit that form. For pregnancy deferral, you'll self-attest to pregnancy and enter your due date, at least for students. Your submitted form will be reviewed and you'll be notified of approval or denial, as you've heard, similar to a process for religious exceptions, which we'll go over more in detail in just a minute. As stated previously, if you get a denial, you will need to proceed with the vaccination process in order to become compliant with the mandate. Can you share a detailed process for map for the exception process? Yes, and actually there's really cool screen by screen screenshots that are going to be posted to Campus Ready, and they're going to put a link in this presentation that will walk you through the process. So if you need to request a medical exception, you're going to, or a deferral, you're just going to go to that link and follow those screenshots, and it's how to log into our healthy messaging, what button to push, where to go, will all be included in that link. Next slide, please. So this is a high-level overview, and it's very similar in a lot of ways to the religious exception process, which you've already heard about. So I'll just highlight some of the differences. So this is for employees, and employees are going to do the same thing that you would do for religious exception in terms of going into healthy messaging for the Davis campus or going into your Qualtrics survey for UC Davis Health. This information is going to go to Sedgwick, and Sedgwick is going to engage in an interactive process where they reach out to the employee for any required documentation. They review, and either they'll approve it at that level and move the employee forward and help them navigate the system, or they'll notify campus, and the medical directors at the campus level will review the request. If they're still unable to approve it, that individual will be notified of denial and they will have to get vaccinated. If there is an approval at that level, it will be communicated back to Sedgwick, and again, Sedgwick will reach out to that employee to help them navigate the system. Next slide, please. This is for students. So students, we don't have Sedgwick. Those requests, it's a little bit simplified. You go to the same patient portal where you've been scheduling all of those COVID tests, where you interact with student health in a variety of other ways. The link will be in the chat. And you'll be able to hit new messages, and you'll be able to download the medical exception form or the pregnancy deferral form. You have to take that medical exception form to your provider, and they need to mark why it is that you're getting the medical exception. They don't need to list your exact condition, but they do need to mark that on their license. They're verifying that you meet one of those categories, including a CDC recognized contraindication or a vaccine manufacturer contraindication. So once you have that discussion with your medical provider and they agree that yes, I attest that you have one of these contraindications and you really cannot get this vaccine, you come back to that patient portal, you submit your completed form, and that will be reviewed here at Student Health and Counseling. You'll be notified if the exception is approved. And remember, if it's approved, again, you have to comply with all those non-pharmaceutical interventions, those NPIs. So you'll still have to get tested twice a week and wear face coverings and follow all other public health recommendations. For pregnancy deferrals, that'll be a temporary exception, essentially, and which will end on or around your due date, and then you'll have to proceed to vaccination after delivery or submit an exception request for a different reason at that time. And so that is the summary of the medical exception process, and I'm going to hand it over for the next step. Thank you very much.
Thank you, Dr. Shoresman. My name is Pablo Reguerin. I serve as the Vice Chancellor for Student Affairs. Thank you all again for being here. We can go ahead into the first slide, please. All right, there we go. So I'll be talking about, to start off, regarding sequestration for unvaccinated students. So again, the information I'm going to review on this slide is for unvaccinated students only. So if you're vaccinated, this criteria wouldn't apply to you. So, but for our students who are unvaccinated, we are going to require a self-sequester in their residence for a minimum of 7 days and have 2 negative COVID-19 tests. Also, the self-sequestration requirement begins when you arrive to the Davis area. So if you're coming from out of state and you may stop in Los Angeles, San Francisco, another part, we don't start counting the 7 days until you arrive to the Davis area. So please keep that in mind as you make your plans. Students should only leave. So once you're doing this, if you are doing the self-sequestration, you would only leave your residence for food, medical needs, such as picking up a prescription, going to get tested. You are not permitted to attend classes in person or the in-person programming that's available to students, such as orientation. I also do want to clarify for orientation, there is a Zoom online version of orientation that you can do, but that would be while you're self-sequestering in your residence. Also, students who will need to sequester should plan to travel accordingly. So counting back to 7 days. So it's important that students arrive to the Davis area at least 7 days prior to the first day of their classes or when they need to end sequestration. In addition to sequestration, unvaccinated students will also need to follow the campus requirements regarding testing and face coverings to access campus facilities. Students who are living with student housing and dining services can contact them regarding this process or any special cases or needs. Our residence halls move-in starts on September 13th. And so there are no earlier dates to comply with the 7-day sequestration. So planning ahead of time is going to be really important. And again, the best way to avoid all of this and the self-sequestration, as you've already heard on this presentation, is to be vaccinated. So again, the information I shared only applies to those that are unvaccinated. There is also a question on the FAQ here. Is there a way to move in early so I can finish my self-sequestration in order to attend orientation events in person? So if you're in the residence halls, we do not have that option available. We have move-in dates that start on September 1st for the apartments, but it's going to depend on if you're an incoming student, if you're a continuing student. So please check with student housing and dining services. You can contact them directly if you want to confirm your plans to meet this criteria. Okay, we can go to the next slide, please. All right, compliance with the vaccine policy. So students who are not compliant with the policy, as you heard, the deadline is September 8th. We are going to flag folks in our database and begin to follow up with students. If you don't meet it by September 8th, there is a process that we're developing to follow up and also escalate consequences if students are not compliant with the vaccine policy. So it will impact the ability to access campus and university programs and services. Certainly will be restricted, and that includes not being able to attend classes, events, or other in-person activities. Once a student is back in compliance with the policy, for example, if you're unvaccinated and you're testing every 4 days, and you don't meet that, and then on the 5th day or 6th day meet it, then once you become compliant again, the restrictions will be removed. I do want to be really clear here that while we're still finalizing the process for our escalation and the exact consequences, students who don't meet the policy requirements, we are going to impose consequences, sanctions, and that will include an interim suspension or even being withdrawn from courses. Protecting your health and the broader community is vital to having a safe community. What the FAQ on this slide is, I'm nervous about getting matched with a roommate that isn't vaccinated. Can I refuse to live with someone that is unvaccinated? So I want to, as was mentioned earlier, we do not collect medical information in terms of housing or housing assignments. So vaccination status is not considered in that process. And again, as Dr. Shorsman, it was shared earlier, we protect that information given the privacy. So it's not considered in the room assignment process. As a public health measure, students who have an approved vaccination exception, again, as I mentioned, will be required to test every 4 days, wear face coverings indoors and outdoors in crowded spaces. And students can put in a transfer request through the student housing once that process opens up. But in short, we will not move people based off of vaccination upon move-in. If there is a standard process for room transfer, and student housing and dining services can be contacted for that process. The next slide, please. Again, it's important for all of our health and safety that unvaccinated students with approved exceptions are tested every 4 days. That's going to be vital. We will have our testing center available for students to get tested every 4 days. And again, we are monitoring and tracking this process. So if students are not in compliance with that testing requirement, we do have an escalation process, which will initially restrict access to campus. And also, as I mentioned earlier, if students do not comply with this policy, we will include interim suspension as a consequence of not meeting the policy. We're going to do a lot of messaging. We're going to try to engage as early as possible, but we're relying on all of you to also follow the policy and guidelines to make sure you're vigilant about your testing, especially if you are not vaccinated. So one of the FAQ here is, I'm only on campus once a week. Do I have to go test every 4 days? So if you are unvaccinated, yes, your frequency to campus and how often you come, as Eric mentioned earlier, doesn't affect the testing requirement. So you need to test every 4 days in order to stay in compliance. Your records will be updated as you complete the testing to avoid any consequences of non-compliance. If you test at an off-campus location, you'll need to upload the proof of your test through the Healthy Messaging portal. And that concludes my slide.
Okay, I'm up next. Hi, everybody. If you can hear me, this is Julia, and I'm going to start us off with information for staff members on campus. There I am. Okay, great. We can go ahead, Grant. So, what are the expectations for employees? Well, just like with every policy we have, every rule to be an employee on campus, you need to be compliant with our policy. So of course, today we're speaking about our COVID policy, and there are 2 ways to be compliant by campus's deadline of September 8th. The first is please to get fully vaccinated. Once you're fully vaccinated, in order to be marked off as compliant, you do need to provide proof that you are fully vaccinated. So there's this little link at the bottom, watch a video for how to do that. If you haven't seen that before, it's quite helpful. There are 2 ways to let us know that you have been vaccinated. If you've received a vaccination in California, You can simply sign off for the university to pull your information from California's database. Another option is you go in and you upload a picture of your vaccination card and you enter the 2 dates you are vaccinated. Okay, so that's the first bucket, is that you're vaccinated and you let us know so we can get our numbers up that Eric talked about on the dashboard. The other way you could be in compliance with our policy is you have an approved exception. So that could be, as we've been discussing, the religious exception, a medical exemption, or if you're pregnant, you can have a deferral. To do that, you're also going to go into healthy messaging, and you are going to complete the documentation that our third-party provider, Sedgwick, requests of you. I believe it's your name and phone number, perhaps your email address. Even if you do get one of those exceptions approved, please be mindful that to be in compliance with policy, you do need to practice the NPIs, the non-pharmaceutical interventions, and those include testing every 4 days and masking. Okay, so the FAQs on this slide. Well, I work remotely. Why would I need to get vaccinated? And the answer is that even if you work remotely, you're still an employee of the university and you still need to follow the university's policies. So we're not saying you have to get vaccinated, even though we hope that as many people as can be vaccinated will choose that route for the safety of everyone. But you either need to be vaccinated or get an approved exception, even if you work remotely. And what is a supervisor's role in supporting compliance? So that's a great question too. Up until September 8th, supervisors should be helping their staff make sure they're compliant. As Eric said, we're not getting into the weeds with, are you going to be vaccinated? Are you going to get an exception? Both of those things would let someone be compliant. We just want to make sure that we're doing everything we can to help our employees do one of those 2 paths. After September 8th, there will be reports run for employees who are on the non-compliant list, meaning they didn't upload their vaccine proof or they didn't have an exception. At that point, progressive discipline would flow as a consequence of not being compliant with the policy. Grant?
All right. Thank you, Grant. This is Health, Danielle Kaler here. The process over at Health tracks closely with that of campus. Our timeline has begun. We took a collection of information around vaccination status throughout the last number of months here by way of the fast track status on that daily screening that we do to come into the medical center and surrounding ambulatory care areas. And that fast track opt-in on Qualtrics is a similar function that we'll be using here for updating vaccination status. So this week we sent out a link with a different Qualtrics survey that does the same exact thing. It collects for us vaccination status and allows an employee to identify whether they plan to request a medical exemption, religious exception, or deferral due to pregnancy, or if they're obtaining the vaccine or plan to, or already have it. And we've got 40% so far of those who were sent that survey on Monday have complied with it and have started the course of their journey. We also added 3 different questions that were asking our employees about barriers to either receiving the vaccination or any challenges that they're having. So that is also providing us information that we can use for opportunities to educate and to outreach to our employees to make sure that their needs are met. So as you can see here, we are requiring that folks are fully vaccinated by September 1st. Again, that's 2 weeks out of the final dose. And we're going through the process of using that Qualtrics survey to identify what the requests are by way of religious or medical or deferrals due to pregnancy. Sedgwick will be handling those just as on campus. And we will have the same NPI and testing requirements for those employees as they do on the campus. In some of the clinical areas, We'll have some different requirements as far as the PPE required that will be following our Appendix A, as we have been throughout this pandemic and before. Same exact for the FAQs as far as working remotely. The policy, as we saw earlier, is going to include as a condition of in-person access to UC locations. But we are asking that all employees comply with the policy, whether they're coming on campus or not on site. And supervisor's role is very similar over here at Health. We have a tracker that we use for our agility system, so we can see in a dashboard-like fashion which one of our employees are compliant or not and where our numbers fare. We're asking that supervisors and managers essentially look and use that tool to be able to guide education, increasing it or decreasing it in their meetings and huddles, depending on what they're seeing there as far as the numbers. Next slide.
Okay, this one kicks it back to me for campus. So what is the escalation process? This is laid out in the system-wide policy. So this is the same. This isn't something that UC Davis created. So again, the date is September 8th. So after September 8th, starting on September 9th, if you haven't proven that you were vaccinated or gotten an exemption request, you wouldn't be in compliance. At that point, you would get a notice that says you are not in compliance. Non-compliance, let's see, the second bullet here is to also speak about non-compliance with the non-pharmaceutical interventions, face covering and regular testing. Either way, if you're out of compliance with getting the vaccine or the exception, or you're out of compliance with the saliva testing or the masking, you're out of compliance with a policy. And therefore, you are subject to progressive discipline up to and including termination. So please get compliance. You don't have to worry about that. FAQ, what about unvaccinated new employees starting after September 8th? So pursuant to the policy, it affords a deadline of 8 weeks after the first date of employment for those employees to become compliant. So that will be presented to new employees through their onboarding, and they will have a grace period of 8 weeks to become compliant. Next slide.
All right, cheers, Julia. The process here at Health, again, very similar tracks with the campus. We will be starting September 2nd. Any employee that has not complied with the policy will get a notice of non-compliance. We will continue in a progressive fashion with those notices and letters by way of progressive discipline for folks who continue not to comply. And we will also continue, as we have been throughout, taking corrective action and discipline where necessary for folks failing to comply with masking or testing. So again, those folks who are starting after, new employees essentially that are starting after this September 1st or 8th deadline, we've incorporated it into our recruitment process. So we're actively working as folks come on board to let them know of these requirements and make sure that they're in compliance as part of the onboarding process.
Good afternoon. I'm Benny Singh, Assistant Vice Provost in Academic Affairs, and we want to just highlight how this policy affects faculty and academics. So next slide. So clearly we want to be have it be understood that the expectations that were highlighted by my human resources colleagues are not different as far as faculty and academic appointees. So those same expectations about compliance affect all employees, including faculty and academics. And it's important to just become familiar with those points that were on those other slides. So in terms of the FAQ question here, what is the department chair's role in supporting compliance with policy? You know, the answer is similar to any other supervisor role or department head role. we'd expect the department chair to monitor that folks are complying with policy. When they get those reports, be sure to pass them on as policy prescribes, as well as monitoring that the other parts of requirements in terms of face masks, et cetera, are being followed. Next slide. As far as escalation, the same steps that were outlined by my colleagues in human resources apply as well to faculty and academics. Those pieces are very important so that we're consistently applying the policy to all that are affected. The only difference here are the policies that apply, and that's in the FAQ there. There are policies specific to both faculty and academic appointees. So for faculty, the policy we would use is Academic Personnel Manual, the system-wide policy APM 015, which is the Faculty Code of Conduct. And then for non-faculty titles, we would look at APM 150. So that's really the main difference, is how we monitor the escalation points down as things progress. Next slide, please. We want to be clear about how does this work in terms of student compliance when in the classroom. So the only ones that will know about this in the classroom are those instructors. So the instructors are responsible for ensuring that students are wearing their masks, as well as those situations in the teaching laboratory setting. So it's important that they follow up and ensure that that's occurring. And as policy prescribes, all are expected to wear their face covering indoors. Although it's going to be difficult sometimes for an instructor to speak clearly with a face mask, we recommend that potentially the clear shields that are available in some masks could be supporting a better way to communicate with the teaching situation and the lab teaching settings. But face shields are not acceptable alternatives. So that's really important. The instructor is also responsible for, in the teaching material, to require students to abide by universal mask requirements. So putting that in the syllabus is really important as well. The FAQ on this slide is, what can I do if the student refuses to wear a mask covering in my class? So, we would recommend that it's important for the instructor to handle this in a way that they'd handle any other type of situation that would be considered disruptive in the classroom setting. So important to probably start with reminding the entire class that there is a uniform masking requirement for the duration of class. Also offer and have a mask available for someone who may have forgotten to bring one. If a student does not comply, maybe potentially bring that individual ask that person to join you in the hallway and start to explain the responsibility of maintaining safety in the classroom and the teaching lab and compliance. Engaging in a conversation is really a nice way to start. Maybe checking in, why is there non-compliance? Is there some type of medical reason or something that prevents the student to do the masking requirement? Then maybe refer them to the Student Disability Office for an accommodation process to begin. Otherwise, the student can choose to re-enter the class and wear a mask, or they may have to leave, right? If the student chooses neither option and intends to re-enter class, the student would likely be referred to OSSJA, and there could be more serious sanctions for having caused some disruption of teaching. And in that case, we'd recommend that the class be canceled for that session if the student does not comply. So this is my last slide. Let's keep moving along.
So as I look at the questions that we've managed to answer so far, we've submitted about 183 different answers, and we'll keep doing so to those questions in the Q&A function, as well as on the website when we wrap this up. We'll post a lot of the follow-up information that we've shared today. Before we wrap up for the day, I again want to thank everybody. On the Campus Ready website, we will share the slides and the recording from this session. We will send an email with that link to everybody that registered for today's session as well. So you can find it, as well as all of the great resources like the exception processes, how to submit one, and what the process looks like after one has been submitted. All of that will be shared with you. If any of the panelists have anything they want to unmute and say before we wrap this up for the day. Well, I'm going to wish you all a happy afternoon. Thank you again for coming. More to come.